among the emerging infections, we should consider different aspects that include viral infections and also bacterial infections. Among viral infections, this year we have seen the outbreak from Ebola viruses in Africa, and this was an important problem for different kind of specialties that work in the area of infectious diseases. Then another interesting infection that has caused outbreak, mainly in the pediatric population, is represented by Enterovirus D68. It has caused severe respiratory infections in the United States at the beginning, but then also in Europe. And it has caused also neurological involvement in patients that develop this kind of manifestations. Then another important problem is represented by the reappearance of infections that can be controlled by the use of vaccine. One example is represented by measles that continue to cause outbreaks in several countries and for which there is a vaccine that is really effective and that should be used in line with recommendations from WHO. Apart from measles, we should also consider that viruses like polioviruses continue to circulate in some countries that are at the end on the border with others where polio has been eradicated. This means that we should maintain very high the control of the disease with adequate vaccination coverage. Regarding bacteria, of course we have the problem of pneumococcal infection. Pneumococcus is a pathogen for which there is an effective vaccine, but of course at the end we have new diagnostic methods that has permitted us to demonstrate that pneumococcal infections are still quite frequent in the pediatric and adult populations, even after the implementation of universal vaccination in the first years of life. Then among the other pathogens, of course, we have the problem of antimicrobial resistance and pathogens like Enterobacteriaceae that are resistant to antibiotics like carbapenems or other class of antibiotics with a quite large antimicrobial spectrum. This means that we should be careful also in our prescriptions because the abuse of antibiotics can further increase the prevalence of antimicrobial resistance. When we take into account bacteria, of course we should consider also the problem of tuberculosis, because when we consider actually the number of pediatric patients with TB, we can really understand that the disease represents an important problem for the pediatric health, and it represents a problem for which it is very important to identify centers in which pediatric patients are followed with all their needs. And finally, I think that the last point is represented by drugs for children. So one of the issues, especially considering the emerging pathogens, viruses, bacteria, and probably also fungi that I have not considered in that part, is the fact that several drugs for complicated infections are approved in the market at the beginning only for adults. And this means that the pediatrician used, in case of complicated infections, even in the neonatal period, drugs that are approved for adults or for older children. This means that it is very important to have studies dedicated to pediatric age, dedicated to newborns if the newborn is a target of the treatment, because only in this way it will be possible to have data on the safety and on the efficacy of the different products.